Hello, I'm Dr. Pamela Hamilton Stubbs. I'm a board-certified sleep specialist practicing in Richmond, Virginia, where I am the CEO of the Sleep Clinic for Children and Adults. Today I'm going to demonstrate how to connect and use your CPAP unit. I will be demonstrating with a ResMed S9 CPAP unit, humidifier, and a nasal mask. Before we get started, I want to remind you that the equipment comes with an owner's manual. The owner's manual, published by the manufacturer, is the authoritative and final say on how the equipment should be used, assembled, and maintained. I also want to point out that the unit comes with a carry bag. Keep this bag in a safe place. In your closet or inside your luggage might be good places. You want to hang on to this bag because you'll need to carry your machine back and forth to your healthcare professional or the home health company to download the compliance card, and also sometimes just to check and see if the equipment is working properly. If you travel, you want to carry your machine in a bag, and if your travel is by airlines, I recommend that you take your carry-on bag as carry-on luggage. Now, let's get started. This is the CPAP unit and a humidifier. They are attached, and so they move as one single unit. We're going to disconnect them by pressing this black button here, which is on the back of the humidifier, and gently pull. We'll start by looking at the humidifier. The humidifier is opened by a button in the front of the unit. You slide this button over, you'll hear a pop, and then gently lift up the lid, and inside you see a plastic chamber where you keep your water. It's recommended that you take this plastic chamber out of the unit when you want to fill it with water, because if you fill it inside of this humidifier and you spill water in the humidifier, you could damage the humidifier. When you have your plastic chamber, you'll look and see that it tells you on the inside that you need to be using distilled water with this equipment. Also inside of this plastic chamber is a little yellow tab that tells you where you should stop with your water. It has a water line. It tells you the place to fill, how much water to put into this unit. Once you fill up this water chamber, you pop it back inside your humidifier and close the lid and push it tightly so that it clicks. In the back of the humidifier is where your tubing attaches, and this tubing is going to go to your mask. This machine has a climate control tubing, and the climate control tubing has coils that go throughout the length of this tube, and what this does is heat up the tubing to decrease condensation of water inside the tubing. In the past, I used to have patients complain that water would accumulate inside the tube and flux into their face and disturb their sleep. Since I've been using this tubing, I haven't heard this complaint. This tubing has an orange lip that needs to connect to a little attachment in the back, which is also orange. You remove this cover. You don't take it off completely, just take it off of the little protruding part in the back, pop it up like this, and it stays connected by a little strap. And then you put your climate control tubing over this clear plastic tube and twist. When you hear that pop, you know that your tubing is secured and in place properly. Now we will connect the humidifier back to the CPAP unit. The CPAP unit has a small tubing here, and there's a larger plastic tubing opening on the humidifier. The small tube goes inside the large tube, and then you just push, and when you hear a click, they're snug together. Now let's talk about the CPAP unit. The CPAP unit's power cord is in the back. It has 3 prongs that go into 3 holes. You'll have to line up the prongs with the hose in the back of the unit and then just push it in. Then this tubing that's coming directly from the unit is attached to this little power unit. The power unit has another cord that has 2 holes in it, and there are 2 prongs down in here. You just push those in like that, and then this this cord is placed into an outlet. And read your manual to make sure that you have your power cords connected correctly and that you're placing them in the right power source. The other thing in the back of this CPAP unit is an SD card, and it's right here. You push it in and it'll pop out, and you can take it out. Sometimes your doctor or the respiratory therapist may ask you to pop out this card and mail it in. And this card is a compliance card. It records the information coming from this unit. The unit records how often you're using the equipment, whether or not your mask has air leaks. It will let us know if the unit is adequately controlling your apneas and hypopneas. And it also tells us about your oxygen level. And you just keep your card right in here. The other thing in the back of the machine is the filter. The filter is a disposable filter which should be replaced about every 2 to 6 months. You will know that this needs to be replaced because it changes colors. If you live in a polluted area, you may need to change it more often. But I think you could get by with changing this about every 2 months. Now let's look at the top of the CPAP unit. On the left-hand side is the on-off button, and on the right-hand side is a knob that allows you to control your temperature of the humidification and a feature called a ramp. When you turn your machine on, you push this button down and you will hear air flow from the machine. Now we'll talk about adjusting the humidification's temperature. You will use the knob on the right hand side to do that. This little window has a little house that says home, below that a water drop, and below the water drop a triangle which represents a ramp. So let's turn the knob and go to the water drop. The water drop has a blue background. The blue signals that this is the temperature currently locked into the memory of this machine. If you want to change the temperature, you'll need to press the top of the button and get a yellow orangish background to the water drop, and then turn the knob, and you can turn it clockwise and the temperature gets higher, or turn it counterclockwise to lower the temperature. Once you have the temperature that you feel will be most comfortable for you, press the top of the button again. You get a blue background, and that temperature is locked into the machine. Next, we'll go to the ramp. The ramp is a useful feature. Sometimes people complain that the pressure is too high and causes them difficulty falling asleep because the pressure is blowing in their face at an uncomfortable level. What the ramp does is allow you to turn on your machine the machine will start at a lower pressure at about 4 centimeters of water pressure and then gradually creep up or climb to the prescribed pressure. So this ramp is currently set at 15 minutes. Let's just use an example of a person who has CPAP set at 8 centimeters of water pressure. When the machine is turned on, it will start at a very low pressure. Right now it's running at 4 centimeters of water pressure. And gradually between now and the next 15 minutes, the machine will ramp up the pressure so that it will be delivering 8 centimeters of water pressure at 15 minutes. The thinking behind this is that you'll be asleep in 15 minutes, so the air pressure will not disturb your sleep. It will actually help you sleep by maintaining the patency of your airway. Now, some people say they can't sleep because it feels as if they're suffocating. In that case, you might need to turn your ramp off. So you turn your knob, get the triangle in this part of the screen, press the top of the button until it turns yellow-orange, and then turn the knob counterclockwise until it reads off. Push the top of the button and lock in off. And now the ramp is turned off, and what this means is as soon as you turn the the CPAP unit on, the pressure will start at 8 centimeters. Now let's talk about the mask. This is a nasal mask, and it fits very snugly into this tubing because the idea behind CPAP is to create pressure. So you have to have a closed unit from the CPAP to the mask. Now the mask has a little elbow. I don't know if you can see that. This little crooked part is the elbow, and it does swivel a little bit for when you're turning in the bed. What you do is you take your tubing and you take the inside of this tubing and put your mask elbow down in there and just push until it won't go anymore, and then you know that it is snugly fit into your tubing. And now your CPAP unit is ready for you to use. I want to remind you that obstructive sleep apnea syndrome is a serious medical condition. If you have difficulty using your CPAP unit, then you should talk to your doctor or the healthcare professional who prescribed this unit. You can also call the home health company or the durable medical equipment company where the machine was purchased from, or the respiratory therapist who fitted you or helped you when you first got this equipment. Getting your machine to a point where you can use it may be something as simple as changing the type of mask, the size of the mask, or some feature on this machine such as the pressure, the ramp, maybe even the temperature or how much humidity is coming from the machine. This video is provided as a community service. It does not replace the manual or making an appointment with a qualified healthcare professional.